Good morning. Thank you, everybody, and happy to see all of you here. One of a very difficult tasks now. I have to wrap it up in less than the allotted time. Well, I'll try to do as much justice I can. So, a topic which is just about 7 lows in liver transplant. So, we kept the theme as the folks during the road to transplant, which many of us must have encountered. No conflicts of interest to declare for this presentation. And what are the 7 laws which I would be just briefing it? It's just a collation of various things. The anesthetic requirements in TROP, CVP, SVR, transfusion threshold, hyponatremia, hypokalemia, and hypoglycemia, the all laws. So first law would be low anesthetic requirement. Do we actually need a lower depth of anesthesia? Excessive death, what does it cause? A post-operative outcome, does it become poor? We know that the endorphins and all these levels are pretty high, so the requirements might be low. Looking at a little bit of the literature of inhalational anesthetics and association with severity of liver disease, it was published in 2010 that lower MELDers would require low MAC levels. Another one where you had a comparison of BIS with the end-tidal desflurane during the 3 phases of orthostatic liver transplant. What I wanted to highlight was the BIS monitoring guidance suggests a lower level of DES requirements during anhepatic and the neohepatic phase. Then they did a study on using the frontal EEG, and again the point highlighted was it showed that both the groups had where MAC was 15% decreased as a standard of care to the other thing. They found that with using of low MAC, incidence of post-operative delirium was particularly similar, and there was no reports of intraoperative awareness or waking up. Another interesting paper, which was published in 2018, was the impact on the early clinical outcomes. They actually looked at 3 volatile agents like isoflurane, desflurane, and sevoflurane. Again, all what they studied was there was no difference, and either in the post-operative function or the graft survival. Then this was put to ERAS for OLT consensus guidelines, and 2 questions were put to this expert committee. That is, does the type of anesthesia, TIVA or volatile, affect the immediate and short-term outcomes, and does the depth actually matter? 14 studies, again low in literature. I would just go that the quality of evidence was low and the recommendation was very weak for the use of volatile anesthetic agents in this as compared to TIVA. Looking at the other aspect, against the quality of evidence was low and the recommendations was weak.